Health officials point to the ever-deadly meningitis as the cause of the strange deaths at the KUMACA Academy.
The current hot, dry climatic conditions we are experiencing here are now similar to those in the northern, thereby shifting the meningitis belt downwards.
The spate of death within 2 weeks has caused public anxiety as parents and students demand answers. You recall a similar outbreak in the Ashanti region claimed several lives in 2015. So what concrete measures are being taken by health officials to control this situation? Is Ashanti Region capital safe, as well as other schools available in the region? We'll be probing further and also get answers from the Ghana Health Service, the GES, plus some independent analysis on this matter. This is today's big story. My name is Aisha Ibrahim. Autopsy reports from different facilities on 3 of the 4 deceased students from the KUMACA Academy point to meningitis. Let's listen to the regional health director who was outlining causes for this. The Ashanti Regional Minister was outlining causes for this meningitis.
From 22nd March to 31st March this year, the lives of 4 students have been lost following reports of ill health. All of the 4 students died in various health facilities in the region, but at different times. Following the report of these to the health sector, a detailed investigation has been established to put in the appropriate measures to contain the situation. With an established case definition, we have had 26 suspected cases with 4 deaths. However, it must be stated that there was virtually no case reported after 31st, though surveillance has been sustained. We will continue to keep a close eye on the situation so that cases can be detected early and managed appropriately. For this outbreak, like earlier ones in the Ashanti region 2008 and 2011, the index of suspicion is low. This is due to the not too common incidence of the disease in the region. As a result, some of the cases are missed and treated as malaria. The population in Ashanti region is less immune to the circulation of pathogens, unlike the northern regions, and thus easily become infected, resulting in high fatality. In addition, the current hot, dry climatic conditions we are experiencing here are now similar to those in the northern, thereby shifting the meningitis belt downwards.
It's however unclear which type of meningitis this is. The Noguchi Memorial Institute in the next few days has been tasked to identify which type this meningitis is, but authorities say some stringent measures are being taken to control the situation. We can listen to the regional minister once more on this.
Interventions that have been implemented at the district, regional and national levels. Meetings of the district epidemic management committee involving all other key stakeholders. Meeting of regional technical coordinating team. Field investigation to establish the cause of death by team made up of district, regional and national personnel. Autopsies of 3 bodies at St. Patrick, St. Michael's Hospital and School of Medical Sciences. On the field orientation of health staff, identification of contacts and follow-up, laboratory testing of all samples to get the causative organism. Next steps, that's the steps that the Minister of Health is going to undertake. Urgent meeting of the Regional Epidemic Management Committee. Designation of hospitals for all senior high schools. which means that each senior high school is going to be allocated with a particular hospital. Orientation of all medical superintendents, doctors, physician assistants, and prescribers on meningitis. Massive awareness of the general public on meningitis and other epidemic-prone conditions. Intensification of surveillance at all levels, including private hospitals in the entire region. Strengthening collaboration between GS and Ghana Health Services to ensure the health and safety of all people and students.
Meanwhile, the Health Directorate says it has already handled 26 suspected cases. They attribute the KUMACA Academy cases to harsh weather conditions. We're still trying to get our man on the ground, Kwesi Deborah, who's been following this issue, to update us on the latest of the story. But pneumococcal meningitis is a serious infection of the meninges. It affects the brain membrane and can cause severe brain damage. It's fatal in 50% of cases, and several different bacteria can cause meningitis. Neisseria meningitis is the one with the potential to cause large epidemic. Of course, that's a serious infection, and we're told that the Noguchi Memorial Institute will in some few days come up with what's really, because we're told 2 strains were identified, and so we're not sure of which of the strains we're experiencing in Kumasi right now. The research institute will tell us exactly what it is. But it's transmitted from person to person through droplets of respiratory or throat secretion from carriers. Close and prolonged contact, such as kissing, sneezing, or coughing on someone, or living in close quarters, such as a dormitory, sharing, eating, or drinking utensils with an infected person facilitates the spread. So it's quite deadly, and the average incubation period is 4 days, but can range between 2 and 10 days. The bacteria can be carried in the throat, and sometimes, for reasons not fully understood, can overwhelm the body's defenses, allowing infection to spread through the bloodstream to the brain. It's quite serious, and so in some few days we'll see what the Noguchi Memorial Institute will be telling us about this. We also, with some of the symptoms, you have stiff neck, high fever, sensitivity to light, confusion, headaches, and vomiting. Those are some of the symptoms. Even when the disease is diagnosed early and adequate treatment is started, you still feel some of these stiff necks, high fever, sensitivity to light, confusion, headaches, and vomiting. All right, let's now go on to the phone lines and speak with Cassandra Chum Ampofo, who is the Ashanti Regional PRO of the Ghana Education Service. Good evening to you. Many thanks for your time, Cassandra.
Good evening, Aisha.
Cassandra, revelations at the KUMACA Academy is stunning, and I'm sure you're not taking chances at all. Are you closing the school down? Or what plans do you have for KUMACA Academy?
Oh, thank you very much. Good evening to your viewers and listeners out there. Well, for now, we have not thought of closing down KUMACA Academy. We all know that final year students are writing their last week. And then next week, which is exactly a week today, the school will vacate. We are planning on having a health screening before they leave. And so should they even leave before next week, We would have to collaborate with the Ghana Health Service to know what exactly to do. But for now, we are planning to have a health screening for all students on campus before they leave.
So what about other schools in the area? They may be at risk too, you know. Do you have any proactive measures for such schools?
Well, for now, after the health screening of KUMACA Academy, we will extend the screening to all other schools. What we are thinking of, or what we want to do, is the Regional Director of Education will summon a meeting of all heads of second cycle institutions and later to basic schools. And then they will deliberate on how the schools and classrooms will be decongested to improve ventilation. And then we started already educating the students on the signs and symptoms. At first, it was on personal hygiene in general, but for now that we know the cause of death of our precious boys, we will be looking at the meningitis as well, the signs and symptoms of meningitis, so that we'll be vigilant. We intend also that should any of the students show signs, we would not give them first aid like we did. Normally they report to the school clinic and then we give them first aid, but now should any of them show any of these signs, we would have to rush them to the hospital for better treatment and so.
But the students have boycotted exams, which was supposed to have started today, and that's very worrying. How are you resolving this issue?
Well, they didn't boycott the exam. What happened was that the student leaders, you know, they are the SRC, the leaders met school authorities and pleaded that now they have divided attention, they have lost all of their mates, and so they requested that the exams be pushed to next term. And then we have accepted that. And so first week of next term, they would write the end of term exams. But before they go home, we'll give them the timetable so that whilst home they will study. And then the first week they will take their exams.
All right. Many thanks to you. Cassandra is the Ashanti Regional Public Relations Officer of the Ghana Education Service. So we're talking about the strains of meningitis that was saying at the KUMACA Academy. We know 3 people have died already, and the symptoms shown the points to this meningitis, but we're not sure, we're not clear of which type of meningitis. So we're told that the Noguchi Memorial Institute is conducting some research to find out which type of strain we're battling with now, and we're also told that it's partly because of the harsh weather conditions we're experiencing in the region right now. But we know that it's a serious issue, and we also know that it's not only KUMACA Academy that is affected. Other schools, surrounding schools, could also be affected. And the most interesting issue is that this strain, we're told, is mostly in the northern part of the country, but we're now experiencing it in the south. That makes it very dangerous. Let's speak with Kwesi Deborah, a man on the ground who's been monitoring events. Good evening to you, Kwesi Deborah. What's the latest with regards to the meningitis outbreak at the KUMACA Academy?
Hello.
Kwesi Deborah, you're on today's big story.
Yes. Can you come again?
I was asking what the latest is on this issue.
Well, as I'm talking to you, the Regional Health Directorate, in collaboration with the Noguchi Memorial Institute, Health Institute for Health Research, they have carried some of the samples to the place, that's the Noguchi Memorial Institute for Health Research, and they are trying to establish the type of strain which is causing the meningitis. As earlier on, they put it out there. That's the meeting which was headed by the regional minister, Mr. Simon Simmons, that they do not really know the exact strain of the meningitis. So now they are trying to establish the strain, and when they come out, they'll be able to they'll be able to address it proper, Aisha.
But have you spoken with the research institute? I'm talking about the Noguchi Memorial Institute. Have they come up with any revelations yet?
No, I'm yet to speak to them. Earlier on, we have that the tissue samples, which are the samples taken from the bodies, are underway. I have no idea whether it is as rich or not, but that is what we were told is underway to the place. So we are waiting for them to come out with the findings of the research. Aisha.
All right. But we know that situations are calm at the school now. But what exactly is happening? Are the students okay now? We know some students were angered. They were angry. Others didn't even want to come back to school. What's the situation in the school right now?
The school, when I was there about 2 hours ago, is calm. The students are quite in the, should I say, composement is to study everything that you've been taught. And exams are supposed to come out today, but unfortunately, because of the atmosphere, they will not be able to do the exam. It has been postponed till next. That's what we've been told, that it's been postponed to next term. So atmosphere is calm. It's only around the campus. I'm talking about the area around the KUMACA Academy, which the residents there are a bit anxious, and they are in six as to what is really happening, and they are trying to find out from the authorities what they are supposed to do with regards to the outbreak of this meningitis.
All right, many thanks, Chukwe, said Deborah. Certainly, everybody is anticipating and waiting patiently to see what the health authorities are going to do about this. Let's listen to the Ashanti Region Minister once more on the measures he says they're taking to address this issue.
Interventions that have been implemented at the district, regional, and national levels. Meetings of the district epidemic management committee involving all other key stakeholders. Meeting of regional technical coordinating team. Field investigation to establish the cause of death by team made up of district, regional, and national personnel. Autopsies of 3 bodies at St. Patrick, St. Michael's Hospital, and School of Medical Sciences. On the field orientation of health staff, identification of contacts and follow-up, laboratory testing of all samples to get the causative organism. Next steps, that's the steps that the Minister of Health is going to undertake. Urgent meeting of the Regional Epidemic Management Committee. Designation of hospitals for all senior high schools, which means that each senior high school is going to be allocated with a particular hospital. Orientation of all medical superintendents, doctors, physician assistants, and prescribers on meningitis. Massive awareness of the general public on meningitis and other epidemic-prone conditions. The health and safety of all people and students.
This is today's big story. Let's do some more analysis. And I have 2 people on the phone line joining in this conversation. First, Dr. Bekwe is Head of Disease and Surveillance at the Ghana Health Service. And the other is Sidu Aho, who is the coordinator of the Universal Access to Healthcare campaign. Good evening, gentlemen. I'll start with you, Dr. Bekwe. 2 things we're sure will happen with this situation. 1, the disease is infectious. That makes it dangerous. 2, not only KUMACA Academy may be in danger, surrounding schools as well may find themselves in this crisis. So what immediate interventions have you put in place to deal with the situation?
Thank you very much. Let me say that the focus is not on just the school. The issue is make sure that we have a broad-based understanding that meningitis has now moved a bit southward. It used to be more of a disease of northern part of Ghana.
Exactly.
But now increasingly we've seen that we have cases being for the southward. Last year we had some cases in Vanafo, and then we have this case in Massive. But this is not the first time. There have been times that you have pockets of such occurrences occurring in these areas. But because of the high temperatures now and the dry weather we have, so we are prone to have such cases. So what we are doing and to heighten the awareness of the clinicians that we need to look out for diseases that are not very critical in your domain. Because if you look at the clinical presentations of some of the cases, you could actually think that this could be malaria or being upper respiratory tract infection, because they come in with fever and headache and sore throat. This is not a typical presentation of meningitis. So it brings to bear that there are new dimensions of how we need to be able to diagnose. So as a service, the clinicians, including the doctors, physician assistants, have been brought to, that we need to look beyond malaria. Let me also say that for this particular instance, there's a type of cases that occurred which was somehow not noticed. Because what happens is that the school, which has a population of about 2,000, has a sick bay. The sick bay has even 3 nurses who are actually residents there. So when you are sick and you go to the sick bay, based on your severity of your illness, it may be referred to the next level. But then that's where the challenge is. The referral is to the parent. So the parent now takes you to a health institution. So you are not referred to, let's say, a hospital, so that you can see aggregation of cases to initiate an alert. And I think that was a challenge that we tried to correct. So one of the recommendations we made was that senior secondary school, or schools in particular, must have designated hospitals so that you can actually detect warning systems and then you can mount immediate response. One thing we also putting across is that for this dry and harsh weather, we need to make sure that people are drinking a lot of water, a lot of fluid.
To
and
be able
make sure that we are improving on the ventilation.
Prevent people from getting such.
That will address the challenge that we have.
All right. Many thanks to you, Dr. Franklin Bekwe. That's all time will allow us. But Sidra Hall is also on the other line. And if you look at the situation, it's quite worrying, considering the fact that these type of outbreaks are usually rife in the northern region. You heard the doctor said, he said that. So to begin to see it in the south is bad news. What immediate recommendations would you offer?
All right. Thank you very much. And good evening to your listeners. You are very right. We had a first outbreak in northern region, that in Bole, somewhere in October 2015. And now that we have this outbreak in the Ashanti region, precisely at the school, the first thing we need to do is to try to contain it at where it has occurred, and that is for the school. We need to try to do contact tracing and try to see how we can find a way to contain these people. Beyond that, we need to begin to look at the wider society in terms of the schools we have across the country. You know, because it is infectious and it can be transmitted from one person to the other through contact. When somebody sneezes, when somebody coughs, if there's that kind of contact, then that another person can get it. We need to do intensive education in KUMACA and every part of the country, especially in this part of the year. And then in schools where we have dormitories with a lot of students staying in one dormitory with physical contact here and there, we need to do intensive education. And the school authorities will also need to put in place measures to ensure we have to reduce overcrowding.
All right.
Yes.
Many thanks to you, Sidra Hall. That's all time will allow us. We appreciate your time on today's big story. That'll be it for today's big story. My name is Aisha Ibrahim. I appreciate your time for watching. Good evening.